So my name is Alyssa. I was the group leader that worked with our students, and I believe Amanda and Caleb couldn't join us here today, but we have everyone else here, I believe. Um, I can just start off the presentation. So we did our group with public health, and basically public health is basically the science of protecting and improving health of people in communities. So I like to tell people, think of population and community health rather than individuals, for example, that are in a hospital. And this includes many disciplines, many jobs, many people involved, from spreading the preventing the spread of infectious diseases to helping climate change. There's so many different vast topics that this field covers. And so we started sort of our project, which is just sort of like the past of public health. When we were going through this, I sort of gave a little fun facts to the kids. For example, like how the field of epidemiology started, and some of the real important topics that are considered the greatest public health inventions that were considered in the 20th century. And so we put some fun facts about how the father of epidemiology, which was one of the core disciplines in public health, John Snow, how he was able to really start the science of epidemiology, and to how we covered drinking water, vaccinations, seat belts, workplace safety laws, how those things contribute to the health of the people these days. And a lot of I think people are misunderstanding, and that public health is really about like medical and how it's only covered the health. But the one thing that I really emphasize to the students is that that's often very misleading, and that there's so many different disciplines and there's so many different topics, such as climate change, obesity, political unrest, all of those things come together to sort of contribute to what public health is. Um, and I believe our students for this was Jenny and Nathan, if you guys want to give it a go.
Yeah, so first we have undergraduate schools. So I listed a couple of popular undergraduate schools that you can get a public health degree in. So there's first Johns Hopkins University, and reason why the school is really good is that it has it's the first and largest school of public health, and it has lots of jobs, internships, student groups, and volunteering opportunities. There's also Brown University, which it has a low student to faculty ratio. It has really diverse career outcomes, and it has a nationally renowned research centers. There's also University of Michigan. University of Michigan has the #1 public research university. There's many study abroad internships, independent study, and research opportunities. It's also ranked #5 as a school of public health in the US. There's also UC Berkeley. Berkeley Public Health prepares students for their 20 plus graduate programs. It has access to a lot of networks, including partnerships with schools like UCSF Medical School. And for graduate schools, there's Harvard. Harvard is the nation's first graduate training program in public health. It has made landmark contributions to public health, and it's the #1 global university for social sciences and public health. There's also UNC. It's a top public school of public health. UNC works in all 100 countries in counties in now North Carolina and 62 countries, and researchers have been awarded more than $1 billion. There's also Yale School of Public Health. Yale courses are graded honors, high pass, or fail, which is great. There's also over 25 research centers and programs, and it also has a low student faculty ratio. There's also Emory, which is ranked #4 in the nation. Students learn in and outside of the classroom, and it's home to 26 centers of research impacting public health. So what are majors in public health? So there's specialized versions in this major. There's about 15 in total. There's biostatistics, child and maternal health, community health, environmental health, epidemiology, generalist public health, global health, health equity, health and human services, health science, infectious disease, leadership in public health, nutrition, occupational health, and social and behavioral science. Some unexpected majors are biostats, epidemiology, nutrition, social, and behavioral science. So some jobs that you can have with a public health degree is being an epidemiologist, and those people basically investigate and describe the determinants and distribution of disease, disability, or health outcomes. The median wage is about $37.75 hourly. There's also a nutritionist. They help promote healthy habits and disease prevention. They get about 31 hourly. There's also community health workers. These people help individuals adopt healthy behaviors. They make about 22 hourly, and there's also occupational health and safety specialists. They review, evaluate, and analyze work environments and design programs and procedures to control, eliminate, and prevent disease or injury. Their median wage is about 37 hourly. There's also health and safety engineer. They promote worksite or product safety by applying knowledge of industrial processes. They make about 48 hourly, and there's also a public health lawyer, and they represent clients in legal proceedings, and they make about 65 hourly. And I think the next person can go now.
Yeah, so the next section is just briefly going over some non-collegiate pathways into public health, or ways to pursue public health without a college degree. So I've listed 4 ways that you can pursue this career. And the first one would be online platforms and certifications, like many other groups before us were talking about. It's the exact same with public health. You can get a lot of certifications online due to recent like the internet expanding and broadening educational opportunities. Another one is internships and fellowships. This is available for like pretty much anyone, even without a degree or with a degree, but you can kind of take on internships or fellowships with different NGOs that wrestle with the topic of public health, such as the World Health Organization or the Center for Disease Control. Another option is military service. A lot of, or all the branches of the US military offer a pathway to become a public health officer, and that's whether you're in the Air Force, the Navy, or in the Army. And then the final one would be cross-disciplinary paths. This is kind of related to getting a degree, but you can get a degree in another field and continue to pursue public health along with the field that you were pursuing. And so while these opportunities might not be a proper replacement for a degree, there were just some options that you could explore if you were wanting to pursue public health but didn't quite have the degree or a major in it.
And so that's our presentation. And unfortunately, some of the students, like I mentioned, couldn't be here with us today. But something that I just really wanted to emphasize is definitely like the name public health itself can be very misleading just because of its highly interdisciplinary nature. But I think the students really got to explore so many other avenues that don't involve like a medical or a nursing degree. And an important thing to note is also that public health, the careers and the salaries really do depend on sort of the states and then their areas of the US that you're in, especially if a state that you're living in decides to invest and fund their public health programs a lot, then there's obviously more positions and more opportunities. So that definitely is something to take into consideration when looking at careers. But thank you.